This PowerPoint presentation is part one of the Introduction to Communication in Health and Social Care, Adults and Children and Young People, Early Years and Childcare. It's part of the Level 1 certificate, Introduction to Health, Social Care and Children and Young People settings, and also the Level 2 Dementia Awareness run by Plato Training. The aims and objectives of this session are to understand the factors that influence communication and interaction with individuals who have dementia, to understand how dementia and other factors may influence an individual's ability to communicate and interact with others, to understand how memory impairment may affect the ability of an individual with dementia to use verbal language, and to know different methods of communication and understand how to communicate with individuals. You will be using your workbook to answer the questions, and it's important that you look out for the green box on each of the slides, usually on the right hand side, to show you which question the slide relates to. It's important that you do share your own ideas when you're working through the PowerPoints. You can use the ideas, but expand, put them in your own words. They're here to guide with pointers, but sharing your own ideas, it demonstrates a more and stronger understanding of the content. And if you do wish to progress to the next level, it shows you're able to do wider reading and have an understanding of a topic that's up for the discussion. So on this slide, you'll see it relates to all of the questions, and there's some important words that you will be using and looking at for this unit. So the first one, verbal communication, which is speaking and listening. Non-verbal communication, so ways to communicate without speaking. Informal communication, so speaking with friends. Formal communication, so this is when information is shared in a professional way and slang words are not used. And finally, communication methods, which is ways to communicate. So we're going to start by looking at what is communication, and you'll see it relates to all of the questions. So communication is a way of getting or giving information. Good communication is very important. So when you're working with others or looking after people, it's really important that you communicate with them. You will often get information from people such as what they want to do or how they're feeling. You might need to give information to other people, such as telling them the time of an appointment or where the bus will pick them up from. So communication is a really important way of getting or giving information to individuals. Now, there are lots of skills needed to communicate well, and these include using facial expressions. So facial expressions are important because people can read how you're feeling by the look and the expression on your face. You can find out things from other people by their expressions on their face as well. So, that's a skill when you're communicating, that you'll look at people, look at facial expressions. Speaking clearly, really important that you speak clearly when you're communicating. People need to be able to understand, so by speaking clearly, that's one way that people will understand what you're saying, and again, you will understand what others are saying. Using language that others will understand, so that means age-appropriate language. If we're communicating with younger people, younger children, small children, you'll communicate in a manner that they will understand, as opposed to if we're talking to professionals or adults, we'll use different communication methods and different language to speak to them. Active listening and active questions. So that is important when you're communicating. It's about listening and focusing, being active, making sure you are listening when somebody is communicating with you, that you are listening and not distracted, and not got other things going on that may distract you, and that you need to be focused and actively listening to what somebody is saying to you. And obviously with the active questions as well, that could also it goes alongside the listening, because if you're asking questions, it shows that you're listening. If you're acting, active questions, important questions related to what's being discussed and communicated, then active questions and listening go hand in hand. Taking turns to speak and listen, and again, another important skill needed. You're listening and you're not interrupting, so you're letting people speak, listening to them, and then waiting for that moment for you to actually take your turn to speak and listen. Having patience and giving people time to speak, again, that goes with that taking turns, making sure that you do give people time to speak, to communicate with you. If you're working with young children, adults with additional needs, service users, sometimes people that communicate slower. We're going to look at, you've looked at dementia. We're going to look a little bit more about people with dementia as well, because they'll forget things. It might take them time to actually communicate. So it's important that we give people time to speak. Showing you're interested in what is being said. Again, that goes alongside active listening as well. Like I said before, it's really important that you show you're interested in what is being said. And using positive body language. Again, that comes with facial expressions. So it's about giving people a smile, being sympathetic. But positive body language is another important skill needed to communicate well with individuals. So there are two different types of communication, and we're going to look at them here. So one-to-one communication. So this means two people having a conversation, and to do this well, you need to ensure that each person is talking clearly, listening clearly, and using facial expressions. So like we talked before, so smiling, and using body language. For example, like nodding when, if you're nodding to someone, they know that you're listening and you're understanding. And then group discussions. So this is when communication is taking place with more than one person. So for example, like telling a group of carers, discussing how to improve the menus for older residents in a care home. And you'll see here the purpose of communication in health and social care and early years settings. So to negotiate and liaise with service users, their family members, with colleagues and a range of professionals to exchange information. To promote interaction between group members, to get to know service users and their needs, to explain procedures to people, and to promote relationships and offer support. So you'll see on this slide there are different types of communication methods, and people communicate with each other in lots of different ways and for lots of different reasons. And I'm going to talk you through them here, and I want you to think for a few minutes before you move to the next slide what you think each of them are. So we've got verbal communication, we've got non-verbal communication, Makaton, communication passports, British Sign Language, Braille, use of signs and symbols, and written communication. So as I say, have a think of those for a few minutes before you move on to the next slide. Okay, so you'll see that this slide and the next few relate to question number 1. So verbal communication, this is when information is given through speaking and listening. Non-verbal communication, this is when information is given through body language, hand gestures and facial expressions, like we spoke about earlier, smiling, nodding, and you might do that alongside verbal communication, or you may just do that without the verbal communication. Sometimes other types of non-verbal communication are needed, so using sign language such as Makaton to communicate, and we're going to look at that a little bit further on. So now you're going to do some research, okay? So you will pause the video once you've looked at the slide here, and you're going to research British Sign Language. So go and find out what is British Sign Language, who may use this method of communication. Also, look at Makaton, who may use this method of communication. Look at Braille, and again, who may use that method of communication. Make some notes on the research. It's good to know for a career in health and social care. And you could also look at the YouTube videos. If you like learning visually, you could actually do some research, and there's lots of videos on the YouTube there for the 3 different types: British Sign Language, Makaton and Braille. So still relating to question number 1, so written communication. So this is when information is written down. So it could be handwritten like a shopping list, printed such as from a computer or in a newspaper. We've got signs and symbols, pictures and visual communication. So this is when information is given through signs and symbols. And you'll see on this slide there's a few different signs and symbols there for some examples. You've got the stop, the children crossing. You've got little coat pegs there on that picture there. So, like if it was in a nursery or a school environment, the children would know where to hang their coats, and they've got pictures on there as well. So, the symbol. So, a child might know that they've got a rainbow on their coat peg. So it's a visual image for them to that sign for them to go and put their coat on there. You can see the tap with that where to wash your hands, where the sink of the taps are. You've got the mobile phone, we've got text messages, notice boards, maps, toilet sign, and letters there. So, that's some good examples there for you to know about the signs and symbols. So the next few slides is an example of a communication passport. So we've put this in as an example, just so you can see what information is included inside a communication passport. These are used when someone is either non-verbal or if they have a disability or a learning disability and actually can't tell you for themselves. So we'll talk you through the next few slides. So you'll see the first page it's an example, as I said, but your communication passport. So it says, please read this booklet about me and ways to communicate. So you'll see there's a photograph of the person on there, and you'll have a part. So my name is, so you'll have the person's name on there, and the preferred. So for example, if this was me, my name is Jacqueline, but I prefer to be called Jackie. So that'd be something that would be on there, so that people know when they're communicating, they use the right name. So the next page is the content. So this is what is in the communication passport, and it must probably have 17 pages, and you'll see there, there's key things you need to know, special people, their family, their friends, how they communicate, etc. So just have a look at those, and we're going to talk you through each one as we move along. So you'll see key things you need to know about me. So I need, certain things that they need, things that they mustn't have or mustn't do, things that they like, and things that they don't like. All important to know about this person when you're communicating with them. Special people, so the most important people in that person's life. For example, the mother, the father, the wife, husband or partner, son, daughter, brother, sister. Do they have any pets? So this would be different for each individual. So each person's communication passport would be different or similar. So this talks about their family. So, like the examples. So my partner, my wife, my husband is, what their name is. We have so many children, their names, their ages, where they live, and if you've got grandchildren, again we have grandchildren, how many of the grandchildren, what the names are, the ages. This page is for friends, so write down, they'll have the friends, who their friends are, what their friends are called. Again, all this information is for you there to communicate, so you can talk about the friends, the friends' names, and you can share that with them. How that person communicates, so understanding other people, how they understand other people. We talked about different verbal and non-verbal language communication, so find out how that person, how they get their message across. How can you help them communicate? So please do Please don't. So again, it's important for you to know what you can and what you can't do. You know, everybody's individual, and it's important if they can't verbally tell you, you know, you'll read it in here so you will know how to communicate. Things that person likes to talk about, how they're feeling, the family, sport, work, TV, the programs they like on the television, what their hobbies are. Do they like gardening, music? Do they go to church? Do they like watching the news? What food they like? And you know what you can talk about, the drinks. Have they been on holidays? All these things are important so you can communicate with that person. So this page is about places, so where they live, um, the family, where the family live, where they were brought up, where they used to live, where they've travelled to. You know, they like to go out to different places, so all this is important to find out. This page is about work, so where they work, what qualifications, what profession they've had or they do, you know, where they work and what they do in their job. This page is about their past, so you know what's happened in the past, so you can put information on there about that. Special moments and events in that person's life. Things that cheer that person up. This page is about things that upset that person. You know, all as important as other, but you know, definitely, you know, you need to know things like this. You don't want to upset somebody, so it's important that you know what upsets them. This page is for the person to let you know what they really can't stand, you know, what they don't like, what they need help with, eating and drinking, so things that you might need to know about that person, you know, especially like allergies, things like that. And this is the last page, and it's about what their site's like, so letting you know what they can see, you know, with their site. And you know, each page for this communication passport, like I said before, is as important as the other. So you'll get to know from this passport, you know, it's the communication method that that person can communicate with you, so you know everything as much as possible about that person so that you can actually work with them and help them. So this brings you to question number 1, and it's asking you to identify at least 4 different communication methods. Okay, in your answer, you need to ensure you use a supporting sentence to show your understanding of each method of communication. And within the criteria, you must use a range of communication methods. So within the 4, or at least 4, so no less than 4, you need to choose 4 different ones. So, you know, don't choose 4 that are verbal. Think about, we've talked about verbal and non-verbal, so use 4 different methods, but a selection of different ones. So these next few slides relate to question number 2, and we're going to look at the different needs, different communication needs. So, you know, communication, it varies from person to person. When you're working in a care environment, you need to ensure you communicate to meet each person's individual needs. It's very important in health and social care and early years care. So we need to take time to find out how best to communicate with someone, finding ways to help a person to communicate and be understood. It will make you know, life a lot happier for someone if they find it difficult to communicate. By you finding out the best way to communicate with them, it will make their life so much happier. So it's very important to find out the communication and language needs of others. So this may include understanding ways to improve communication with a person, so such as asking them questions. You know, what time would you like lunch? Observe the individual, watch the child communicate with friends, see how their language skills are developing. So by observing them, you can pick up the best way for you to communicate with them, because you'll find out through observation. Ask other people who have They may have useful information. So, if you're working with children, young adults, ask the parents or family members how best to communicate with a person close to them. So just by asking questions about how best to communicate with someone will help to support good communication. But sometimes you need to ask the parents, the families, or other support services for help. Healthcare workers will often look at a person's records or care plan and see if there's any information about the best way to communicate with that person. And when you're working in care, you could be working with people of all ages, so from babies to older adults or people with learning disabilities. So it's really important to communicate in an appropriate way so that good communication takes place and to ensure that all information given is easily understood. It's part of the job role of a healthcare worker or an early years worker to find out these needs and to look for ways to communicate well. We do have to communicate with individuals, so it's really important that we find out the best way so that as we say, you can communicate well. So how do we communicate with babies? Well, when we're speaking to babies, the language that we use is called parentese. And this involves speaking in a higher pitch than usual, sometimes using a sing-song voice, repeating words, and using simple sentences, but making them short sentences. And have a think if you've ever communicated with a baby. Do you do these? You do them, sometimes you just do them without even realizing. I know I know I often, speak in a higher pitched voice when I'm talking to my granddaughter. And I do repeat myself quite a lot, just so that I can communicate well with her. Again, when communicating with babies, you must ensure that you use lots of eye contact and lots of positive facial expressions. Babies pick up from that. Often people think that you shouldn't, we don't need to communicate with babies because you don't get a lot back. Actually, you do. Those facial expressions, the eye contact, those babies will be looking for that, and they will be reacting from your expressions. Um, the babies, they communicate back through different, like the sound in their cries, and then they begin babbling and gurgling, and that's their way of communicating with you. So communication with children, so it's important that you develop a trusting relationship. We talked before about active listening, so active listening skills using signs, pictures, translators and interpreters, a good understanding of non-verbal communication when we're communicating with children, and it's important asking open-ended questions that will lead to a conversation instead of just yes and no answers. So asking a child about, so they may have been for a trip to the zoo, in saying, did you go to the zoo? You could say, oh, what did you see at the zoo? Tell me about your day. Tell me about the zoo, So that's important when you're communicating with children. And communication with young adults. So it's really important that we avoid patronising them. We need to establish a bond, a good rapport with these individuals. We need to give praise and reassurance. And again, we need active listening skills when we're communicating with young adults. It's important that we find out about what their interests are so that we can communicate with them and we can, have an understanding about them, because young adults, when they're teenagers, they can be difficult times for them. So it's really important that we try to get on the same wavelength as them and communicate with them in a positive manner. So this brings you to question number 2, and you need to give 3 ways to communicate with babies, 3 ways to communicate with children, and 3 ways to communicate with young adults. You need to write in sentences and about each example to demonstrate your understanding, and you'll see in the left hand side you need to write the way to communicate, and then you need to write a sentence to explain what it means when communicating with the babies, with the children and with the young adults. And it's 3 ways for each 3 for each person. So we're now going to look at a few slides relating to question number 3. So we know, how can we identify an individual's communication and language needs, wishes and preferences? So think about that for a few minutes. How are you going to identify what their individual needs are? So trial and error. So sometimes the best way to establish communication and language needs of an individual, especially if you don't know them, is to start off by chatting to them and asking how they prefer to communicate. If you're not getting a response, try other methods, so gestures, pictures or writing, until you find out what works best. So it could be that you've met someone, you don't know them, but you're just having finding out at that point the best way to communicate with that person. Observation. So we talked a little before about observation, but by watching how they communicate with others, so you'll be able to see what works well and then apply it to your practice. Observation and in observing an individual while you communicate with them can give you visual clues as well about their interests and their understanding. Speaking to the family and friends, again, we mentioned this earlier, but family and friends, they know those people better than anyone. So it's important, that you speak to them and you ask them the best way to communicate. So reading somebody's care plan. So an individual's care plan should describe their communication needs, wishes and preferences, and it should be described in detail so you can use this information to ensure that you communicate with them in the best possible way. Speaking to other professionals. So other professionals that have previously worked with an individual may be able to direct you on what communication methods work well and which don't. Professionals can include the individual's psychologist, nurse, social worker, their advocate or tutor, as well as any other care workers. So this brings you to question number 3, and it is asking you to outline how to identify an individual's communication, language needs, wishes and preferences. Remember to use sentences within your answer to develop a paragraph. Think about the last few slides that we've talked about, and obviously, do your own research and use your own ideas as well. So we're now going to look at slides relating to question number 4, and we're going to look at barriers to communication. So a barrier to communication is anything that stops communication taking place. So over the next couple of slides, we're going to talk about some of the barriers. So a language barrier. So this can be when, for example, when people speak different languages. An environmental barrier, such as a very noisy room. So if there's background noise, it's a barrier to other people to communicate. Emotional barrier. So when perhaps someone is too upset or to give or to receive information. A physical barrier, so when someone is visually impaired and cannot see the facial expressions or the body language to know if someone is being serious or not. A hearing barrier, so this is when someone cannot hear clearly or cannot hear at all. A cultural barrier, so when an acceptable way to communicate in some cultures, so such as pointing to a sign, it can be seen as rude by other cultures. So for example, eye contact is usually really positive, but in some cultures it is classed as very rude. A social barrier, so including words that others do not understand or speaking in a way that makes others feel uncomfortable. So what I want you to do now, I want you to do some research. So you need to have a look at the 7 different barriers to communication, and I want you to go and find an example for each of the barriers. So for an environmental barrier, a psychological barrier, emotional barrier, social, speech and language barrier, cultural barrier, and English as a second or additional language barrier. So you do your research, and then the next slide you've got question number 4, but what your research here will be your answers for question number 4, and you can record them in your workbook. And here is question number 4, asking you to identify the 7 barriers to communication. A communication barrier is something that may prevent someone being able to communicate. And obviously, because you're identifying, remember, you must put a supporting sentence to show your understanding of each of the barriers, and a list will not be accepted. You need to put that supporting sentence. So, go and do your research and look at those 7 different types of barriers. So we're now going to look at slides relating to question number 5, and we're going to look at the promotion of communication and how to overcome barriers. So the barriers that we talked about in the last question, how can we overcome them? So here's some examples. So using preferred language, so including British Sign Language. So, if we know that somebody's preferred language, we'll know that we have to use that. A use of human aids, so for example, interpreters, translators. The use of technological aids, so hearing aids, induction loops, braille software. Cultural awareness, active listening skills, the need to give individuals time to respond, and speech and language therapy. So have a look at these next two slides and you will see on the left hand side it says barriers to communication, on the right hand side ways to overcome the barriers to communication. Now there is bits of missing information where you'll see the blank boxes there. So I want you to think about what the gaps could be, and if we just start, we'll look at the first one. So children, older adults or wheelchair users who may be lower down than others. So that's a barrier to communication and ways to overcome. So make sure you get down to the same level as others so that you can make good eye contact and allow the child or person to feel included. Now, on the next one, we've got the missing box to the barrier. So you've got to think about what that barrier could be. The way to overcome that barrier is to use an interpreter to communicate information. So we'll do this one together and then I'll let you have a look at the others yourself. So the barrier to communication, if we need to use an interpreter to communicate, it would be that it could be a language barrier, that somebody doesn't speak English as their first language, so we'll use an interpreter to communicate the information. So have a look at this slide with the other blanks and the next one and fill the missing gaps. And here's the next slide. So we'll do one of them together. So for example, the barrier to communication is the chairs are placed too far apart or not facing each other, and how we might overcome that barrier. Well, we can move the chairs, we can move them closer together, and we can also enable them to be facing each other. So you're now on question 5. You're going to identify at least 4 factors that promote communication, and then you're going to write how each of these factors can help the service user to overcome their barrier to communication. You'll see that you've got the box, so the left-hand side, factors that promote communication, and then on the right-hand side, how this can help the service user to overcome communication barriers, and make sure you use sentences. And the tip there, look back at question number 3 and think about what could help to overcome the barriers that you looked at in question number 3. So we're now going to look at slides relating to question number 6, and we're going to look at the level 2 dementia. And we're going to start by looking at how dementia influences an individual's ability to communicate and interact in everyday living. And dementia can influence an individual's ability to communicate and interact with others. We've previously focused on cell death within the brain, and now we're going to look at what happens when the cells die. This unit, it allows you to learn about the effects that cell damage or death have on an individual's ability to communicate with dementia. So dead or damaged cells, how do they play a part in communication problems? So, have a think about that. If the damaged or dead cells previously transmitted communication signals to the brain, then there is a high probability that an inaccurate signal or no signals will be transported to the part of the brain that supports an individual to communicate. And if this happens, then individuals could find it difficult to take part in conversations, successfully exchange information. They'll find it hard to build relationships and to retain friendship. They'll find it hard to learn and generally share information with others. So question number 6 is asking you to explain how dementia may influence an individual's ability to communicate and interact. When you're explaining at level 2, you need to ensure that you're using full sentences and developing paragraphs. And I know you've looked at some level 2 stuff already, so you should know what to do and how to do it. Structure your answer into 3 paragraphs, so 3 to 4 sentences per paragraph. Ask your tutor if you're not sure, but you've got to explain To explain, remember that you need to use the conjunction, the joining words such as because, therefore, however, but, as, and they will help you to develop that, that explanation, because you're actually, you're giving an explanation of what you're writing about. So think about, how dementia may influence an individual's ability to communicate and interact. Look at the last slide we talked about, and elaborate on some of those things that are on there. So we're now going to look at other factors that may influence an individual's ability to communicate and interact with others. And this relates to question number 7. And we're going to look at it within 2 categories. So we're going to look at medical factors and the social factors. So we're going to start by looking at the medical factors that may influence an individual's ability to communicate and interact with others. So it's not only cell death that causes communication problems. Often, physiological changes. So for example, constriction of the cerebral circulation, which is a lack of blood flow to the cerebral arteries and veins that supply the brain. A degeneration of the brain cells, so a decline of the nervous system cells or death of the nervous system cells. Aphasia, and this is an impairment of language, so affecting the production of comprehension or speech or reading and writing. And agnosia, so the inability to interpret sensations and recognise items. So they're all medical factors that can influence an individual's ability to communicate and interact with others. And you'll see here there's some definitions to explain what some of those words mean. So we're now going to look at social factors that may influence an individual's ability to communicate and interact with others. And to start, just to say there's not always a physiological reason for communication difficulties, and this is where the social factors may happen. So the individual may feel unsafe, they may feel fearful, or could generally be unhappy. They could be experiencing abuse or neglect, and staff and family using inappropriate communication may make them feel increasingly confused or uneasy. Other residents, so they may be in a care home with other residents, and they may be acting aggressive towards the individual with dementia because they've got their own dementia or mental health issues. And these are the social factors that may influence this. So question number 7 is asking you to identify at least 4 factors, so no less, but at least 4 factors that may influence an individual with dementia's ability to communicate and interact. And you will see it's a level 2 question, so make sure you write in sentences within your answer. And that brings us to the end of the session, and I'm just going to run through the aims and objectives again. So now you've completed the session, you should be able to understand the factors that influence communication and interaction with individuals who have dementia, to understand how dementia and other factors may influence an individual's ability to communicate and interact with others, to understand how memory impairment may affect the ability of an individual with dementia to use verbal language, know different methods of communication, and understand how to communicate with individuals.